So we found very strange stuff in his blood, which I haven't seen in 30 years during microscopy. So it's.
So when did your patient come in? This client, when did he come in, and when did you test his blood, and what vaccine did he get?
Yeah, so meanwhile I have seen a lot of different patients, some of them right on the same day even, some patients after a week or two, or months later also. So, but the effect is always the same. The coagulation is a big problem.
Right.
Yeah.
And how many patients have come in that were vaccinated where you've tested their blood?
At least 60, 70.
60 to 70 patients. And one of the common things that you've seen is corrupted blood amongst.
It's the coagulation, and also we have actually thrombocytes, platelets in the blood, and they can coagulate together and can build a kind of coagulation clots. And this is to see also a lot in these patients. They have to coagulation.
Can you define coagulation for people who don't understand it? What does coagulation mean?
So at one point you get blood cells like this, that they come out and stuck all together. Yeah, this causes coagulation, but also the build-up of bigger thrombocytes, so thrombocytes, clots, and fibrin. Fibrin are these little strings in the blood. They're just like a web what they're creating, and this web can really make your blood really sticky and not flowing.
Right. These are your photos, right, of your micrographs of your patients who have taken the vaccine.
The vaccine.
So
what we see here, that the red blood cells are all stuck on each other, so they stick like pancakes, we could say. But it's a coagulation problem, so they're stuck on each other. And what we also see is this big thing here in the blood, which I cannot explain exactly what it is, because I cannot analyze it deeper here with my equipment, but I can assume it's a graphene oxide or something.
So have you ever seen this before?
No.
You have never seen this before?
No.
How many years have you been practicing?
30 years.
So Dr. Peggy has been practicing for 30 years, guys. She's never seen anything like this. Let that sink in for a moment. She's been testing blood for 30 years and she has never seen this unknown object here, okay? Now, Dr. Young has the equipment to test what that is, right? He's got, what is it called?
Electronic microscope.
Electronic microscope, which allows him to test the actual substance